Hi there. Welcome to our Fireside chat, and today's topic is mental health, specifically in schools. And we've got a fabulous panel here today. So I will let them all introduce themselves. So I'm Adam Shaw. I've got a background in mental health. Specifically, my parents were both psychiatric nurses. So I actually grew up in a psychiatric hospital. So that's, it could be argued that this is something that I've been doing all of my life, and it's a field that's fascinated me. So let's go around the fire, as so to speak, today, and we'll start with Chris.
Lovely, welcome everyone. I'm Chris Dyson, head teacher of Parklands Primary School up in Seacroft in Leeds. A fantastic sort of group together to chat today about the challenges that we're going to be having. My school starts back on Monday, but it's been really interesting seeing the feedback from schools that have already opened this week, which I'm sure we'll talk about later on.
Fantastic. Suneta?
Hi there everybody. Great to be on this fireside chat with you today. Yes, I'm Suneta Bagri and I've been in primary education for the past 20 years. I have been a head teacher of 4 different schools over the last 5 years in interim leadership roles, and I have a vast background of self-development, personal development and self-care due to some of my own personal experiences, but also the fact that I've witnessed a lot of teachers burn out in some of the challenging schools that I've led, which have enabled me really to campaign for positive mental health and well-being of our school staff now. So thank you. I look forward to engaging in this conversation with you all.
Thank you. Martin?
Hi, my name's Martin Richards. I've been a teacher all my life, primary, secondary, adult education. I've taught maths, I've taught English. Most of all, I've taught people. And most recently, working with teachers as a coach, as someone who stands behind and beside whilst they do their work and then supports them in reflecting on what they could do differently so that they don't burn out.
Fantastic. And Gaurav?
Thanks, Adam. Yes, I'm founder of LetsLocalise, and very keen and very passionate about the topic and the challenges that I think teachers and head teachers and the students are going to be facing over the coming few weeks, hopefully not months. And from students' perspective, coming back into the school, having gone through what they've gone through over the past 4 months is definitely going to be anxious. And then on top of it, they have to take control of this anxiety, manage this anxiety, because they will be tested for their knowledge soon, which can possibly impact their year-end results. And from a teacher's perspective, they also need to be very anxious and conscious of the fact that if they catch the virus, they can possibly pass it on to many families and impact them. They have, and other than that, they cannot not be without the job. They obviously cannot afford not to do the job. Economy is not very good. Job market is not very good. And along with all that, they have to care for something very simple, which is, and very minor detail that they have to care for, which is to teach the students and build the future. Very daunting task as I see it, and head teachers will have to live with this nightmare for the foreseeable future. So I'm hoping that as part of this chat, this discussion, we'll be able to give them some simple tools to identify some early signs of mental fatigue and take some remediation actions. All right, Adam, thank you so much.
Well, absolute pleasure. Well, I think it's a fabulous platform, Gaurav. I think it's great what you're doing. And let's talk about, well, it's definitely a problem because the government guidance really depends what mood Boris is in and what day it is and what bumbling ramble he's decided to take us on. So really the government haven't really given a lot of guidance here, and it seems to change quite regularly. So let's talk about the problem first, the current problem, the current climate. And I'd really like to ask Chris, what are the main issues that teachers are facing right now?
So there's 2 sort of paths that we're having today. I'm so pleased that we're going to be looking at sort of the adult mental health and the well-being at the same time as the children. Now, as adults, We understand how adults think and adults work. I'm so excited to be getting back into a routine, but at the same time, I do appreciate that for some staff who've been on the list, haven't been in school for six months. So the challenge, we're coming back to actually tomorrow, just to get people to come in and say hello to everyone, social distancing wise, just to make that first step to get the feedback in the door. You're right about the guidance. You know, the guidance has been messy since June, and that adds to people's anxieties. That adds to people's sort of stress levels. Is it going to be safe? I've got an elderly mum at home. You know, I've got dependents and things. So we've got to make sure that those staff feel comfortable and happy coming into school. Then we've obviously got to look at the challenges for the children. Now, what we've done at our school, we've got just lots of wellbeing work, lots of welcome back to school, trying to unpick all this sort of COVID crisis. Until we actually see the children come to school on Monday, it's going to be difficult to envisage how they are feeling, how they've seen this. Because children are very resilient. Children don't show a lot of fear. Fear is sort of installed in them from the adults. And looking at the feedback this week from schools that have opened, schools are absolutely delighted with how they've come in and they've just got straight back on. It's like they've not been gone. I don't know who in the DFE decided to say that everybody is 3 months behind in learning, because we don't possibly know that yet, because the children have just come back in. Don't worry too much about the catch-up, because back in 2014, when the new curriculum came out, for example, things like in maths moved from year 5 down to year 3. So there was, what do year 4s do? Well, all that work they've missed. And children are resilient. I think they're looking forward to coming back into school. So although we've got enough sort of mental health and well-being lessons to cover us for that first half term, it might be that after a couple of days, the kids just want to get back into doing some creative writing, some artwork, you know. So but it's going to be very interesting to see. Luckily enough, the teachers have been really proactive in this sort of crisis time, because as you said, the guidance is changing left, right and centre. Do we wear masks in school? Do we not wear masks in school? Do you wear masks when you're teaching? And all those other things. So no, it's going to be really interesting times, and it's going to be great hearing what other people's ideas are for bringing the best out of the staff, bringing the best out of the children, while still keeping as safe as we possibly can.
Absolutely. Well, it's I can only imagine the logistical issues that are going on, but I think that's a really good point as well, that the kids, it seems that nothing's changed as far as their mentality and outlook is concerned. It's really taking the fear from the parents and how that translates. Martin, I mean, what's your view on the current issues?
I was picking up on what Chris said about children looking to adults to see where the fear level is. They don't necessarily generate the fear in themselves. They pick it up from the adults. So if mum and dad are scared, they will be scared. If the teachers are scared, they're going to pick it up too. So the place to apply any effort around reducing fear is with the adults. I don't think we need to dump our fear on the kids. So it comes back to the resilience thing. They're going to turn this into a game. They're going to turn the COVID moment into some sort of ring-a-rosy game, out of which they will somehow channel the uncertainties of how do we do things in school these days. They're going to make up something about that. They're probably aching to go back to some kind of normality, and welcoming the moment to be with their friends again, and looking to their teachers for guidance. And the teacher who walks in scared of infecting their parents, perhaps they got sick parents at home, that's going to spread through the class. So somehow we need to help teachers display non-fear, whatever that means. And it comes down to head teachers like yourself, Chris. What a wonderful opportunity to show some incredible leadership, to just keep your chin above the horizon and radiate hope and confidence, so that your staff in the school pick up on that and walk into their classroom spreading the hope. I'm sorry about Boris, you can't do much about him.
Yeah, it almost seems like a comedy year. It's very funny until you realise that he's actually the leader of the country, and the guidance throughout this year has been well, I don't know. We won't delve too far into that, but it certainly adds to the issues. Weak leadership or confusing leadership will always influence down the funnel, so to speak. Suneta, what's your experience so far?
Yeah, so really, when I came out of my head teacher position, I came out in order to really campaign for the mental health and well-being of teachers, as I mentioned in my introduction. So my fear really is that I was, campaigning around the teacher well-being index figures that were released in November, which was way before the pandemic. So if we already had a highly stressed workforce, then the fear that I have is this pandemic has clearly just exacerbated a workforce that was already on its knees. Now, if we do not put in the right measures right now, that is, I mean, it was needed before the pandemic, let's face it, Chris, you would agree,
Definitely.
77% of teachers was reported as stressed. We've got up to, I think it was about 36% of teachers that don't even talk about mental health because there is so much stigma around it in the school environment. They're afraid of speaking about mental health because of this negative connotation, because of the fear of what their school leaders may think of them, what their team may, their colleagues may feel, how they might be letting children down, how they'd be letting the parents down in turn. So my concerns are, if we've already, before the pandemic arose, if we had teachers that were displaying these fears, they were displaying this anxiety, these high levels of stress, then what are we going into now? What are these poor teachers to expect now? So that's really my fear, that COVID is going to certainly exacerbate our vulnerable teachers and our highly stressed and our teachers that were hanging in by a thread. That's what I'm really willing to support my colleagues. I've been kind of doing a lot of work recently with a number of different stakeholders, and I might not be a current serving head teacher, but my heart's still in education. My passion is education. Speaking to you all, I feel very much part of that workforce. I've never turned my back on education. I'm just doing something slightly different to support this, this absolute necessary campaign of making sure that well-being is placed at the heart of our educational agenda. So let's put it there where it belongs, which is in the school's development plan. That's where it belongs. It needs to be coming from our leaders and our governors right from the top. So that's what I'm really, passionate about, doing and supporting.
Fantastic.
Yeah.
Is there any feedback on the platform that you're getting, Gaurav? I mean, what are teachers engaging in this area at the moment?
Yes, lots of teachers are writing back. There are pretty bad stories that we keep hearing. And I was sharing with Chris yesterday only, we came across a head teacher, a local head teacher who lost 2 of its teachers to COVID over the last month. They died, right? It's not a good sign. I know a head teacher who's currently down with COVID, and he doesn't know what's going to happen in 2 days' time. And these are very anxious times, right? So if, going back to your point, yes, Chris needs to display the leadership in order for it to permeate down to the rank and file. But if the leader itself or himself or herself is struggling to cope with it, what do you do? And that's also a very common scenario, right? So teacher knows firsthand, head teacher knows a couple of teachers who are down with COVID. He himself is down with COVID. I know a head teacher who's lost a deputy head teacher to COVID of Windsor, a school over here. So these are not easy times. And you never know what's coming around the corner, how bad it's going to be.
I think it's very relevant as well, what you're pointing out there. I mean, kids' immunities are likely to be much better. And as far as the immediate risk is concerned, I mean, they're likely not to be as concerned, unless, of course, they've got very fearful parents. But I mean, this is a very real situation, I'm guessing, that every school has a certain percentage of teachers that fall into that vulnerable bracket. I mean, how are we, how is that being addressed at the moment? I'm going to throw it open now, so whoever feels like speaking, just pop in.
Just to make sure that the risk assessment, I mean, what I did with my risk assessment was I went through it thoroughly with my senior staff, shared it with my teachers, got people to comment, and then I took the decision to share it with the national union, National Education Union, the biggest teaching union who's got the most members and things. So I thought, if they're happy with what we've done with going over the top to make sure our staff are as safe as possible, then we're hitting the right lines and things. And the NEU wrote back and said, we love your risk assessment, you've gone over and above. Because again, we've got to understand that we've still not got a vaccine for this yet. And people know that. And when we all shut down in March, well, we're no further forward now than when we totally shut down and things. You could argue track and trace is still not probably running as well as it should do yet. But it's just, the staff just get upset and frustrated when you've got things like people who've had shielding letters. And then August the 1st, shielding letters don't count anymore. Everyone's safe to go back to school. But are they really safe? What's changed for these really vulnerable people? So, as I said, it's making sure that the really anxious staff and the people who have been shielding, we've gone above and beyond. We give options that staff can wear masks or visors if they feel more comfortable. Everybody's got wipe down areas. There's a wipe down bottle between 2 in every single classroom and things. Just try and support those teachers that, yeah, we're back into school now and things, because the economy does have to get going. We can't just stay at home for the next year and things. But our own well-being, we need to be interacting with people. We need to be interacting with children and things. So yeah, it'll be interesting to see how next week goes and things. So yeah.
Absolutely. I mean, I can only imagine the logistical challenges that are going on now, especially at schools. And you know, what are the main things that have changed?
The main things is, if you walk down my corridors now, there's hand sanitizers every 100 meters. There's extra soap in the toilets. You know, there's extra wash stations and things. So when the government talk about let's get back to testing, absolute nonsense, because we're going to be spending so much of our sort of school life now washing hands, repeating washing hands, wiping down, not getting ready for a pointless exam in reception year 1, year 2, year 4, and year 6 that mean nothing to your future life. The things that matter are your GCSEs and your A levels. We need to get them sorted out of the disaster that we had sort of this summer.
Yeah. Well, that seamlessly transitions onto the next subject. I mean, I don't know. I mean, I've got 2. You know, I've got a niece and a nephew now that have just had their exam results back, and it seems to me like a national disaster. I mean, how is that influencing, you know, the things at school and the mental health of the teachers, the students? I can only imagine.
It just highlights that gap between the elite and the sort of well-to-do schools and the schools that, you know, have a really bright spot. I'm blessed that my daughter goes across the road to one of the toughest high schools in Leeds, at Leeds East and things, because I wanted being part of this community and things. She came to my primary school for 6 years and I absolutely loved it. Changed community perspectives and things. But she would have been punished by going to that school because she's an exceptionally bright girl, but the algorithm that the bill was over a 3-year average, you know, so basically her grades would have been downgraded. But your luxury grammar schools, your independent school, through no fault of their own, because their 3-year average was so high, the children were getting what they thought they was going to be getting. So the algorithm was totally wrong. And the fact that they released it, knowing it was going to be an absolute car crash, was heartbreaking. But on the benefit, my son got his GCSE results the following week, a week's time. They used a bit of common sense. We'll trust the teachers. So he was so anxious after those A-level results come out. He was like, "Oh my God, I'm not going to get my grades." And I've never seen him care about school. It was really nice to see him caring. But at least he didn't have the anxiety of opening his papers thinking he was going to get B's, and he's ended up with B's and E's. I think so.
I just add, Adam, your question earlier, I'm just going to go back to that. You said, what's changed? And, you know, really, Chris, from what you just explained and from my current understanding, the focus has changed from teaching and learning, deep and meaningful, rich learning experiences, to risk assessments, to clinical risk assessments. And children don't learn under those, you know, that in that environment and under those circumstances. So that's truly sad. But also, again, picking up on your point there, Chris, is the fact that, you know, we don't know whether there's going to be a second wave, and will the teachers have enough time to develop those connections and those meaningful relationships with their students? What will happen if we have a second wave as predicted later this term? How can that teacher assessment start to take shape so that teachers can, I mean, it was a car crash. Let's not even talk about the debacle. It was so shocking. But on the other hand, the teachers still had, you know, 1.5 terms of being able to teach those children and getting a good gauge of being able to assess them. A concern here is that if we're in the position later that they don't have that opportunity, especially teaching in bubbles, and Gaurav, you were speaking earlier about one of the schools being in you know, almost an acrylic zorb, not even being able to sort of connect with the children in that manner, then how are we going to be able to teacher assess the children accurately as well? So there'll be all of those fears that are allaying. And, you know, teachers are compassionate people by nature. We're caring people. We pride ourselves on our relationships with our students. And that's the other fear that I have for teachers, because we, you know, let's face it, no one went into the job for the money, did they? You know, we didn't go in it for the pay. We went in it to be able to develop those relationships with the children, to be able to achieve that sense of gratification that you get from the job, from teaching children and seeing children learn. But under the current environment, so much of that is going to be taken away. And it's some of those things that are going to be really mentally affecting our teachers, not being able to have the connection with the children in the same way. So I would definitely be encouraging our teachers and our school leaders to find ways of how they can do that, especially as some schools are still going to be learning and putting a lot of learning on digital platforms.
For sure. I mean, we're listening to you talk about this. It reminds me of my days back in nursing, where there was so much paperwork and risk assessments and stuff that we had to do, that the care was being provided by the care assistants. It was so much paperwork, you know, our hands were tied. We're there to do a job. And I mean, how much is that the case now in schools? I mean, it has the amount of risk assessment, paperwork. I mean, how that must be affecting the teachers.
Again, the risk assessment is something that needs to be done. But again, every time the guidance changes, you've got to go back to the risk assessment. That's then got to go back to the governors to sign it off and things. So it has been lots and lots of sort of paperwork for risk assessments. But our priority is to make sure that risk assessment is sort of followed through, as opposed to, as I said, getting primary school children ready for, let's do some testing. You know, yeah. I mean, they've said they want to do the year 2 to do the phonics test at the end of the first term so they can see how far behind they are. Why? They've been out of school for 6 months. Yeah. You know, let's just why waste time 2 weeks testing them when we can be teaching them? You know, get the love of reading, not we're getting you ready for this exam and things. So
Chris,
that's a challenge.
Really important point, isn't it? Because we've actually, you know, language plays a huge part, doesn't it? And actually how we're speaking about the children being 6 months behind now, we're feeding that language into the children, and language feeds beliefs. So the children are going in with the beliefs that they're behind, and teachers are going in with the beliefs that the children are behind. And again,
then you do a test, and then, oh, I failed. Well, that's going to do your mental health brilliantly. You know, I've not had a lesson for 6 months, and I'm sitting doing a test and things. So.
Yeah, absolutely.
It'll be interesting to hear from Martin. Martin, what are your views? So risk assessment is a point in time exercise. So maybe we were assessing ourselves in terms of risk in a positive manner. We feel everything is okay. But come tomorrow, as things change, which they will, as things will evolve, which they are at a very fast pace, teachers are going to be exposed to lots of different things, which will start to affect their mental health. Yeah. So what kind of signs can you look out for from a head teacher's perspective, Chris' perspective, that possibly could trigger action?
Well, the signs aren't going to show up until maybe a month or so in, because as teachers come back from the break, they'll be adjusting to a new reality. So how they were, the kind of person they were prior to this break, and who they are when they come back. There may well have been a shift. There may have been a loss in the family. So we don't want to go too quickly, like week number 1, oh, you've changed. But it is change we're looking for. So any specific sign, like you mentioned coffee drinking, for example. I mean, we're not talking about X number of cups of coffee as being the trigger point. But if you notice that someone who used never to drink more than a cup of coffee a day is actually clunking away at 3, 4, 5, 6 cups, there's a change in their behavior. That's when you need to step in and ask the question, how are you? It could be that they are snappy in their responses. They could be making lots of silly jokes. They might be exaggerated in some way, or they might be withdrawn. They might simply not be contributing in the way they used to. And Chris, when you ask your staff, you kind of know who's going to say what. You've got an understanding of what your staff is like. But it's when they change, when the person who used to be outgoing is suddenly withdrawn, that's a warning sign. It doesn't need action so much as attention. And a head teacher who can spend 30 seconds waiting for an answer to the question, how are you? Really giving that teacher a chance to land in the fact that the question does mean something. It wasn't just one of those tick box questions. Be saving an enormous amount of time later on when the teacher comes along and says, you know what, I have to quit, I have to take a break for 6 months because it's just too much. Getting in early is very important, but again, not too early. Same thing applies to the children, that there are kids who are boisterous and there are kids who are quiet, of course, but it's when they swap, when they do something that they don't normally do, that red flags come up. But I would be suggesting focusing on the teachers, on the adults first and foremost during these weeks, partly because there's fewer of them, and partly because if we get that right, the rest of it will fall in place much more easily. If our attention goes on, for example, as Chris again mentioned, testing the kids, I mean, that's just crazy. It's not where the attention needs to be. It really needs to be on caring for, paying attention to the adults in the team. Slow pace, just noticing what's going on, asking an honest, how are you question, walking beside them in the corridor, keeping that eye contact, you know how to do that, and waiting for them to say, oh God, this is really scary. And then you can have the conversation. Or they can say, yeah, I'm really scared, but I can handle it. Good. Because we're entering a new reality. We're not going back to things the way they were before. We're not going back to normal. We're going into something completely new. So all of us have to deal with a new reality and a changing reality, as we mentioned with the government's direction on what we should and shouldn't do. It keeps changing almost daily. So they're going to need someone who can buffer that for them. Yes, we've heard what the government said, but give it a week, the advice might just U-turn again. So again, it's an opportunity for fantastic leadership.
No, let's share a little joke. I was talking to a psychiatrist a few days ago, and he was telling me during these times, we were talking about a change in behavior. So I was asking him, how does he assess? People must be reaching out to him about different sort of scenarios. And he said, yes, people come and talk to me that during these COVID times, they are self-isolating or living by themselves, etc. So they've got into this habit of talking to the walls. And his reaction to that is, well, that's fine. Talking to the walls is okay. That's common. But the problem is when walls start to talk back. That's when that's when you have to reach out to him.
When you lose an argument with the wall, that's the thing. You're having a conversation with yourself and you lose the argument. You think, what's going on here? Actually, that's a great conversation to have with staff, is what's normal. In stressful situations, the following is normal, because they may be experiencing things that are abnormal for them and worrying about it, and therefore spinning on that kind of worry. And if you just let them know that, you know, the following 5 symptoms are entirely normal in this abnormal situation. If you're feeling any of these, hey, congratulations, you're alive. And they get to be too much, here are things you can do. Here's some like general prevention things you can do. The work I was doing as a coach was mostly listening to teachers, expressing their fears. Great word, expressing your fears. You get them out there. You get them out there in words, you get them out there on paper, we write journals. And I don't do anything more than encourage them to get it out there, put it down on paper, put it in whiteboards with, you know, different colored pens, just put it out there. What does today feel like? What does it look like? Oh my God, they take out 4 pens and go, "Arr!" And then they kind of a little bit express, you know, it's really, really hard. Oh, good, it's out there. And then you can let go of it. Good thing about whiteboards and paper, you can sort of put them away.
I mean, I think you've picked up on a great point, Martin, about some people, we're all different. As a leader, we've got to manage our squad. And we know in any football squad, any cricket squad or netball squad, whatever, you've got more confident, loud players, you've got quiet, sort of reflective ones. And it's same with the school teaching. I've got some teachers that can't wait to get back. You know, in June, when we started reintegrating, they want to work every single week. But on the same hand, I had to have sort of marshmallow hands for sort of comfort. That's a good one. Never know where that was coming from. I had staff that were so anxious and couldn't think of anything worse than coming into school. So I let them have the choice and stay at home, because I had enough people who were desperate to want to come in. And I know that when I've got all my staff in that hall tomorrow, I'm going to have these people like myself, like, yeah, let's stop thumping, let's get back on it. You know, in a way, we want to welcome them back. I'll have 50% of my teachers like that. I'll have 50% that are confused. You know, I've had a children letter, why am I all right to be working again now? And it's funny, when you look at some of the head teachers on Twitter, you've got people like myself that are all embracing, yeah, come on, positivity, let positivity shine. You've got some heads that have really been drained. And going to Suneta's point, they're suffering burnout because they can't take any more of guidance changing and being released on a Friday night after 6 before a bank holiday weekend. And those are the heads that I've got to try and support, because although I'm like, oh, positivity and things, I know that at the back of my mind, things could go wrong. I try and look on the positive things, but different people focus on that anxious side, and I'm going to make sure my staff's all right, and they're getting really stressed out over lunch times and things. Whereas, let's just see how it goes. It's a brand new adventure. We can't Google to see what's best to do because we're in unprecedented time. Yeah. We've got to be supportive there for heads, for staff, for children, you know, and that's what we've got to be looking out for absolutely everybody.
Yeah.
Well, this is the whole point. And I mean, it's not just what goes on in the schools either. I mean, when I deal with mental health, it's very much you go into a corporate environment, you go and deal with an individual. There's 2 aspects to everybody's life. There's their professional life and there's their personal life. And usually, if there's a mental health issue, one will infect the other. People will bring problems from home to work, and people will bring work problems to home. And I guess, you know, through doing things at school and putting stuff in place is addressing half of the problem. But it's as you say, Martin, you know, everybody's got their own mood or expression. There's stuff happening in people's lives, and there's sort of things that can tip people over the edge. You know, death of a relative, looking after, you know, diagnosing someone in the family that's got dementia. I mean, that is probably one of the most single impacting things, you know, the stuff that happens, you know, an illness in the family. I mean, that will always have an impact in people's behavior. And it's also been discussed earlier when I was, during my nursing days, the most important thing was the 5 minutes where I went round and spoke to each patient. And sometimes it's like a sixth sense. You can tell behavioral changes because normal is different to each individual.
Yeah.
And you know what might show up as a mental health issue in one person is completely normal for another. And it's that knowing, it's that constant gauging and monitoring of what is normal for the individual. And
I mean, we're in a lucky position that time's changed so much in the last 10 years. Myself, Gaurav and Monty Panasar yesterday were talking about this. About 10 years ago, Stan Collymore came out and said, I'm suffering mental illness and things. And he got absolutely slated. Nobody took mental health seriously. It was a case of, you're a multi-million-pound footballer, you've had all these people that love you, you can buy what you want. How on earth do you suffer stress? And it really got ridiculed. Now, 10 years on, people are encouraged to talk. You know, mental health now is being seen as, and well-being has been seen as a vital component that's been lacking for years and years. We do need government investment in this, because if we can solve mental health issues of children before they leave to high school, then in the long run, we're going to save millions and millions of pounds when they get into adult life. I'm lucky at my school that with the funding that I get in, I've got five learning mentors that cover everything from bereavement to detachment disorders to dealing with well-being. And so I'm lucky I've got staff in place that can actually spot the signs, and knowing your children is everything, and be able to put productive sort of solutions in to help them get back. There's some schools that are really, really struggling. They haven't got any learning mentors. They haven't got enough TAs. And it's those are the schools that we need investment in. So, because as I said, if we solve problems before they get to 10 years old, then their adult life is going to be a lot more productive for the economy and the country. It is if these mental health issues go on into later into adult life and things.
It's strange that we don't do that calculation for mental health, but we do it for bricks and mortar. I mean, I have a lot of building going on around here right now, which makes you think of it. We spend millions on building houses, and the person who's building is not going to get their money back in their lifetime, but they sell it to a company and a consortium and blah, blah, blah. We don't do the same with the kids. And here we are, it's not bricks and mortar, investing in meat and blood. That's strange that we don't buy into that same kind of logical thinking.
Yeah.
What was your experience, Martin? I think last time you were telling me, or telling us when we were talking as a group, you mentioned that you had to go and share a talk to a school which had lost 2 students in the same week. How about 4 students in the same week?
Yeah.
They committed suicide. So what was that like?
So the situation, the school is in a particular area. So, you know, you can, I can't name it, can I? No. And there seemed to be some kind of epidemic of suicide, self-harm and suicide. And the question was, what do we do about it? How do we prevent suicide? And it seemed to be such a simple thing, but investment now in awareness, support between peers, support of the staff, so the staff could pick up on the signs. They kind of didn't know, but they did. They didn't know what to do about children that they thought were behaving a little bit differently, a little bit more withdrawn, a little bit more acting out. They handled it, you know, but they didn't pass on the information to someone saying, you know, I think we should do something about so and so, because there wasn't the extra staff to do that. There wasn't the extra investment to do that. We were talking about the cost of having someone like myself come in and train the staff, contra the cost of 4 burials, which was a grim thing to put on their plate. But it was the reality of that particular school in that particular time. 4 deaths, and it wasn't quite enough for them to say, you know, you're absolutely right, we have to do something. It was not easy to convince people when there's money involved now and the return comes so many years later. It's like, and of course the idea would be, I'm a business, I'm only out there trying to make money. Not really, I'm trying to make a difference. And even with the statistics, there were quite a lot of kids who were self-harming. And then these 4 who committed suicide. I think within a period of a couple of weeks, it made the local national news. We don't want that to happen again. And it requires all of us to be a little bit more vigilant and be willing to just ask. I mean, I come back to the same question. How are you? How are you doing? How crazy is this unreality for you? Because as we move into it, we will learn how to be resilient to this continually changing reality. I mean, who knows what rules will apply next month or the month after regarding hand hygiene and exams and everything else. We just don't know, but we need to be confident that it doesn't matter. I will still study because I enjoy it. In fact, it's a great distraction from all the other stuff that's going on. I can be a good friend. I can be a good teammate. There's all sorts of things I can do about now, which will have a positive effect on my future, not just the exam results, of course. So yeah.
Well, it's a couple of really interesting points there. And going back to yours, Chris, I mean, when Stan Collymore came out, I mean, it was very much a sign of the times and that generation. It's like, what do you mean you've got a mental health issue? It's like, you know, get your shit together, you know, man up a little bit and get on with it. I mean, I think in that field, it wasn't really till the death of Gary Speed that people started taking it seriously. And it's like everything else, which relates to your point, Martin. Unfortunately, this is one of those areas for a lot of industries that it's not until something goes drastically wrong and costs them a ton of money that people understand that maybe they should have put in a little bit of intervention to prevent this in the first place. It could have been prevented.
Yeah.
You know, part of serious mental health issue is tracking back and finding, well, where did this begin? And it's often people not feeling that they can talk to anyone about this stuff. So, you know, the stuff that you're talking about, Chris and Suneta, about just being aware of the little subtle differences with the staff and the kids. I think it's really, really good to hear that, you know, this is actually happening at some schools, but I'm certain that there'll be other schools that are probably a little bit back in the dark ages when it comes to monitoring the behavioral changes, which can be very subtle in the early stages of mental illness.
There'll be some schools that are not giving staff their performance management this year because they've not been in. There'll be some staff that are going down the disciplinary route if someone feels that anxious they can't come into school. And these are the people that are making the decisions that aren't on the ground every single day. They might be a CEO sat overlooking 52 schools, sat in their own little office at home, dictating what should be happening. So being on the ground and seeing your staff and speaking to your staff face to face, social distancing obviously, is absolutely vital at this time, as opposed to just being dictated to from somebody who's not there.
Absolutely, Chris. I couldn't agree more. And I think that's the point that, you know, I've been trying to make. When I came out of my head teacher role and set up the Every Teacher Matters project, it's very much about prevention rather than reaction. And this was, again, my point that I made right at the beginning. It was needed before this pandemic. So now we cannot shy away. We cannot hide any longer behind, you know, the teaching and learning alone. We now, it's a time for us all to stand together in this profession and support our colleagues. And Chris, you wouldn't be this head teacher. I know that from this conversation alone, but I do follow you on Twitter. I know, you know, I get a really good sense of the type of leader you are, but I'm sure, you know, you've referenced there some of our head teacher colleagues that, you know, don't necessarily have that positivity and the mindset to have tenacity and resilience in this, because being a head teacher is a very, very difficult position, and only if you won would you understand the responsibility that comes with it. But, you know, I've worked in a number of different schools in a number of different environments where there are head teachers and CEOs and leaders that do tell teachers to leave their personal baggage at the front door and don't bring it into school. And I think that's, again, another reason why I was compelled to set up the Every Teacher Matters project because it doesn't work. That doesn't.
I want to connect with this on after we finish this. So Gaurav, when we finish this chat, could you put us 5 into just a normal tweet, just to make sure I can follow everybody?
Absolutely, that'll be awesome. That'll be awesome. We'll do that. And I just before we wrap up, and I'll hand over to you, Adam. Right after this, I read in LinkedIn, somebody reached out to me, a teacher, and he mentioned, "We are not armed forces. Don't put us on the front line." That's it.
It sounds about right. And I mean, it's such a, I mean, in teaching as well, it's got to start at the top. It was the same in the NHS. A lot of the interventions came down from people in ivory towers that we'd never seen. And if you lose that connection between the decision makers and the people on the ground level, then that is where the system goes wrong. So, you know, it's great to hear, you know, what you're up to, Chris, Suneta, Martin, you know, about bridging that gap, which is always in any industry. That's always where the problems is, that disconnect from the top to the bottom. And finding the bits in the middle. So the time's passed really quickly during this chat, as I thought it probably would, and it is that wrap up time. So let's just get some closing statements, any summaries of where we're at and what you want to leave, the message you'd like to leave everybody with.
So, well, I'll start off just. There's 2 paths. We need to be seeing signs of difference between the adults that are different to the children, and we need to be proactive. And Marty sums it all up. How are you? How are you? To gauge how people are feeling and things. We've got to be supportive. We've got to realise that everybody's not like myself. Other people are more vulnerable and things. But everybody needs to be treated to bring the best out of them, just like any football team. Get the best out of your players, and your players will produce everything for you.
Great. I think from my perspective, excellent talk. This talk will be available for all the head teachers and teachers as we make the recording available. So if there are any outstanding questions, please reach out to info@letslocalise.co.uk, and we'll have a follow-up chat maybe in a month's time, by which time we would have seen how things have transpired, what evolution has happened. Where are we with the testing, etc., whatever else is going to be happening over the next month. And then we'll have a better sense of the next set of topics that we want to talk about.
Brilliant.
Great. Thanks, guys. I'm going to stop the recording.
Every child has a unique dream of what they want to grow up to be. No matter what their hopes and ambitions are, our education system should help children achieve them. But doing that isn't cheap, and per pupil spending has fallen by 8% over the last decade, which means schools have little money left to upgrade facilities or fund extracurricular activities. With fewer after-school activities, we are spending more time on digital devices. And that's a problem because increased screen use is linked to issues like social isolation and childhood obesity. The Let's Localise vision is to tackle these challenges with a digital platform that helps schools engage with local communities. On Let's Localise, pledges can donate time, money, or skills. And schools can use corporate social responsibility programmes to augment their resources. This will help to address broad social issues by replacing screen time and encouraging students to live healthier lifestyles. We aim to work alongside the government and re-establish ties between schools and local people, making communities stronger across the UK. But is this realistic? Yes, it is. Our surveys showed community-minded people across the UK want to contribute to schools. All they're missing is a tool to help them do it. Connect, collaborate, and contribute with Let's Localise.